Labour MP Stephen Kinnock has issued a stark warning that the NHS could collapse if immediate reforms are not put in place. In a fiery interview with GB News, Kinnock declared, "If we don't reform the NHS, it will die." His comments have sparked widespread debate about whether Labour's proposed changes can save Britain's beloved but ailing healthcare system. Kinnock didn't hold back, blaming the crisis on 14 years of Tory neglect and incompetence. He pointed specifically to the 2012 Andrew Lansley reforms, which were aimed at decentralising the NHS, but have been criticised as a complete and utter disaster. According to Kinnock, these reforms have left the system broken, fragmented, and struggling to meet even basic patient needs. "We're essentially starting from scratch," Kinnock explained, arguing that Labour's approach will be different because the public now understands the severity of the crisis. The country loves the NHS, but they know it's broken. They want to see it fixed, and they want real change. If we don't act now, the NHS will die. Kinnock's remarks come at a time when the NHS is facing unprecedented strain. Record waiting lists, severe staff shortages, and underfunding have pushed the healthcare system to a breaking point. "The choice before us is very stark," Kinnock emphasised. "If we don't reform, the NHS will collapse under its own weight." Now let's check out a clip of Stephen Kinnock's powerful statement where he declares, "If we don't reform the NHS, it will die."
Well, I think we've had 14 years of Tory neglect and incompetence where they haven't really tried to reform anything apart from the Andrew Lansley reforms in 2012, which were a complete and utter disaster. So we are, in a sense, starting from scratch. I think there's two reasons why it will work this time. One, because of the depth of the crisis that we're in. The country loves our NHS and care system, and they want to change it, they want to reform it, and we know now that if we don't reform, it will die.
Kinnock's dire warning comes as the NHS struggles to cope with ever-growing demand. Waiting times for surgeries and treatments are at record levels, with patients waiting months or even years for critical care. Emergency rooms are overwhelmed, with patients forced to wait hours to be seen. The staffing crisis has become one of the most urgent issues, with healthcare workers leaving the profession in droves due to burnout, low pay, and poor working conditions. For Kinnock, these aren't just temporary issues, they are signs of a system on the verge of collapse. The NHS can no longer meet the basic needs of the people it was designed to serve, Kinnock explained. Without bold and immediate reforms, we will lose the NHS. Labour's plan to save the NHS includes a massive recruitment drive aimed at bringing more doctors, nurses and healthcare professionals into the system. Kinnock stressed that improving pay and working conditions will be crucial to attracting and retaining staff. "We need to make the NHS a place where people want to work," he said. "That means better pay, better working conditions, and providing the resources healthcare professionals need to do their jobs properly." Addressing the backlog of patients waiting for care is another key priority for Labour. Kinnock emphasised that the current situation is unacceptable, and Labour plans to inject more funding into the NHS to help reduce wait times. "We will make sure the NHS has the funding it needs to clear the backlog and provide timely care," Kinnock promised. Kinnock believes that the scale of the crisis will provide Labour with the political capital it needs to push through its reforms. "The public is ready for change, and we're ready to deliver it," he said. "The NHS can't survive without bold, decisive action, and that's what Labour will provide." While Kinnock pushes for reforms, another scandal is brewing over NHS spending. A recent investigation revealed that NHS trusts and other public sector bodies spent £655,700 on Pride Month celebrations, sparking outrage from critics who argue that the money should have been spent on improving healthcare services. The spending, which included rainbow-painted pedestrian crossings, drag bingo events and rainbow badges, has been branded bonkers NHS waste by Reform UK and the Taxpayers Alliance, TPA. Freedom of Information requests revealed that several NHS trusts were among the biggest spenders, with Humber Health NHS Partnership spending £770 on rainbow badges and North West Anglia NHS Foundation Trust paying £950 to paint rainbow stripes on pedestrian crossings. University College London Hospitals NHS Foundation Trust organised a drag bingo event while Hartlepool Borough Council hosted a drag queen story time as part of their Pride celebrations. Critics argue that these expenses are inappropriate, particularly given the financial strain on the NHS. Lee Anderson, MP for Ashfield, expressed his frustration on social media, writing, "Our underfunded NHS is already overwhelmed, yet taxpayer money is being spent on drag bingo and rainbow fudge. It's an insult to every taxpayer who's waiting hours in A&E." Anderson's comments have resonated with many voters who are concerned about where their money is going when the NHS is struggling to provide even the most basic care. Reform UK leader Richard Tice echoed these sentiments, calling the spending bonkers and a failure of financial management within the NHS. The NHS should be spending every penny on improving patient care, not on frivolous events, Tice said. This is a clear example of wasteful spending at a time when the NHS is crying out for more resources. An NHS spokesperson defended the spending, arguing that promoting inclusivity is essential to creating a welcoming environment for all patients. It's important that LGBT+ patients feel safe and respected when accessing healthcare, the spokesperson said. These events are part of ensuring that inclusivity is felt throughout the NHS. Despite these justifications, the controversy has fueled calls for greater accountability in public sector spending. Critics argue that taxpayer money should be focused on essential services like healthcare, rather than on non-essential events. The backlash is likely to grow as the public scrutinises how the NHS is managing its resources during one of its most challenging periods. Labour's plans for NHS reform aren't the only source of controversy. Chancellor Rachel Reeves is facing criticism over her rumoured proposal to raise capital gains tax (CGT) as part of the upcoming autumn budget. The move, aimed at increasing revenue for HM Revenue and Customs (HMRC), has been met with concern from business leaders and economists who argue that a CGT hike could damage the UK's competitiveness. A study by the US Tax Foundation and the UK's Centre for Policy Studies, CPS, found that the UK already ranks poorly in terms of tax competitiveness, sitting 30th out of 38 OECD countries. If Reeves proceeds with a CGT increase, the UK could fall even further down the rankings, making it one of the least competitive tax systems in the developed world. Daniel Herring, a researcher at the Tax Foundation, warned that, if these tax hikes go through, the UK could end up with one of the least competitive and most anti-growth tax systems in the OECD. Herring argued that raising taxes on capital gains would discourage investment and innovation, further slowing the UK's economic recovery. "We need to be encouraging investment in the UK, not driving it away with higher taxes," he said. Reeves has not confirmed whether the CGT hike will be included in her autumn budget, but business leaders have voiced their concerns. They warn that increasing CGT could deter investment in key sectors, such as tech and startups, which are vital for the UK's future economic growth. If Labour pushes forward with these tax increases, it risks driving away investment, said a spokesperson for the British Chambers of Commerce. The UK needs policies that encourage growth, not ones that make us less competitive. In addition to the rumoured CGT hike, Reeves is also considering reforms to inheritance tax, IHT, and increasing national insurance contributions for employers. These potential changes have sparked further debate about whether Labour's tax policies will support or hinder economic recovery. With the autumn budget just weeks away, Reeves faces a difficult balancing act. She must find ways to raise revenue for the government's ambitious public service plans, while ensuring that the UK remains competitive on the global stage. The stakes couldn't be higher for both Labour and the UK's economic future.